My name is Luming. I am the new Chief Medical Officer here at the Harris Center, and I am coming from Connecticut. I am delighted to be here, and my role will be to really think about the medical offerings of the center and also improve access, as well as look at the quality of care that we service to our clients. And so I'm really excited to be doing that. I think what's been really wonderful about the Harris Center is just the diversity of the different types of clinical services we offer. What attracted me here was really the fact that it is a really amazing and exciting opportunity to be able to think about how can we innovate around the services that we deliver, and I think it will be a really important role to be able to do that. So I am excited to participate in that. I really like working with the other executive members of the Harris Center, and I've just been really impressed with Wayne, with his leadership and innovation, and so I'm thrilled to be part of the team. So I am a psychiatrist by background, and so I trained in medical school, then got 4 years of advanced training in psychiatry. I've done a fellowship in health and aging policy fellowship, and I've also done some advanced work in quality and safety. So I've gone out to Intermountain to do a specialized course on how do we improve care in our clinical settings. I've also gotten a master's degree on health sciences, focusing on quality improvement, and all of that. I mean, what drives me to do work in the behavioral health area is really the fact that our patients sometimes are short-shifted. So we don't always have the right kind of clinical spaces for them. Sometimes it's not as nice and warm feeling and as well invested. And so I really want to look at that and think about how can we do that better? How can we give patients and clients the type of environment for treatment that we would want to send our family members to. So I'm actually really liking Texas so far. I think that I've been told that August is not the best month to move here, but I have to say the silver lining is that we've missed several hurricanes. I have a beautiful house in Sugar Land. We have just a really wealth of warmth, right? I'm just so delighted to be surrounded by warmth. I actually like the heat better than I like the cold. Yeah. And even though I thought it would be hard to go jogging in the morning, I've gotten myself up at 6 in the morning so that I could do my jogging routine, and it's been going okay. It's been going fine. So I've really liked it so far in Houston, and I hope to continue to be here for a while. So really, really investing in the community and excited to be here. Jogging, I like mountain climbing, I like traveling, although we're trying to do less of that. Please do less of that while during this pandemic. And I just love being around people who are passionate about what they do. So I've been so impressed with all of the people I've met at the Harris Center in terms of their enthusiasm, passion, and I'm excited to be contributing as part of the team. There are many things I'm looking forward to. I was just thinking about what I want to do as my goals as the new CMO, and there are a number of different things I want to do. So one is I really want to make sure that we as a staff are safe and that we're in our clinical settings making the clinical care as high quality as we can in the setting that we're in a global pandemic, right? And so what are the things that we can put in place to keep ourselves well, but also keep our patients safe in the setting of this pandemic? I think number two, I'm really excited about thinking about how can we improve quality in a very intentional way, and toward that end, we've been working very closely with individuals in our IT department as well as in health analytics to think about, well, what can we do to look at patient outcomes, track where they are, where they can be going, and really have data at our hands when we're making evidence-based clinical decision making to really serve the needs of clients at the time that they're receiving care. I'm also really excited to build up our services. I'm really hoping to expand access to individuals in the outpatient spaces. I'm really hoping to continue to serve patients in a safe way in our emergency rooms. I want to really build out our pharmacy services as well, and thinking about the role of the pharmacist in our clinical areas, and really continue to make sure that we can pay for these services in a meaningful way and continue to obtain the grant funding, and also the building the community infrastructure so that we can really make sure that people know about what we're offering, and then also make sure that our services can continue and endure. So I'm really looking at new models of care, quality of care, access to care, all in the setting of keeping us safe.